Oh, the COVID vaccine is expected to roll out as soon as 24 hours after the FDA approves it. They'll make a decision on the Pfizer vaccine next week on December 10th, followed by the Moderna vaccine on the 17th. Meantime, states are grappling with some tough decisions on how to distribute this limited supply. 10 on your side, Stephanie Harris found out how they're doing it, Steph.
Well, Tom, the decisions are complex and they include ethical and scientific principles. Today, I spoke with Dr. Lori Furlano, Virginia's Deputy Commissioner for Population Health, about how they are making these tough calls.
I think this is an emotional topic. It evokes a lot of emotion, and I think that's reasonable.
Dr. Lori Furlano gets that people who want the COVID-19 vaccine are anxious. But when there's not enough to go around, the state has to prioritize.
These are difficult decisions. Every Virginian is important to us in these decisions.
The us she refers to consists of the state's Vaccine Advisory Work Group, made up of more than 100 doctors, nurses, pharmacists, and other health professionals, as well as the Virginia Disaster Medical Advisory Committee.
The decisions about vaccine prioritization obviously are complex ones. They include considerations of things like important ethical principles, scientific principles.
For instance, who the vaccine is most effective in.
For example, studies are not yet complete on children, so they're not considered right now in our priority groups.
And logistics, such as how to ship and store the vaccine that must be kept at an ultra-cold temperature.
The first priority right now is to get through approximately 500,000 persons, which in Virginia that make up the healthcare worker or long-term care resident groups.
Who goes next?
It's a little hard to get into the weeds on that right now because we don't know who those groups are going to be just yet. We're starting to have those conversations about critical infrastructure workers, essential workers over the next, say, week or two.
Those workers include other healthcare workers, first responders, teachers, port workers, and more. They're hoping the CDC will provide some guidance. Now, you heard Dr. Furlano say right now the priority is that 500,000 person group of healthcare workers and long-term care residents. Well, Virginia is expected to get 70,000 doses this month and continue to receive additional allotments weekly after that. How much is still up in the air. The CDC will distribute based on population. And Virginia makes up about 2.5%, she said, of the U.S. population, so we could be waiting a while to get everyone a shot. Stephanie Harris, 10 on your side.